Okay, video journal number 1 on caring. So first of all, I just want to say thank you to Carrie and Jesse. You guys have no idea how much I'm really enjoying it up here. This is a really cool experience. I've been able to do a lot of things I wouldn't be able to do at home. So I'm really enjoying my time here, and I'm very thankful to you for letting me come up here. So thank you. So I'm going to talk a little bit about caring. And kind of my definition of caring. Over my 4 years of nursing, caring to me is ensuring that both the patient and the family of the patient are comfortable and feel as at home, I guess is the right word, as they can in the situation they're in. Because the situation they're in is never good, not usually good. So I really try and make them feel as welcome and give them as much support as possible, because I know the position they've been in, because I've been in it before, so I try and care for them as much as possible. Working in the Emerge, here I've found that there's a big difference between the way a nurse in Emerge would care for a client or patient to the way a nurse on medicine or surgery or an acute care ward cares for a client. I find it's a lot different. The nurses in Emerge seem they're very quick. They really want to, get to the problem, find out what's wrong, and kind of move on. So the caring, in my definition of caring, isn't quite there as much. They certainly care about the patient and trying to get them well, but that's not at the same level, I don't think. They don't ensure that comfort. They just ensure that they're getting well, and their job is to figure out what's wrong so they can either go to the doctor, go home, or move to the acute care ward or wherever. So I find the nurses, at least in this situation, the Emerge nurses don't have the same level of care as an acute care nurse would. Some of the acute care nurses that I've spoken to about caring and things like that here, I haven't had a chance to work in the acute care ward, but I am going to in a couple of weeks. They really stress the fact that being in a small community, a lot of people, everybody knows everybody, and there's a lot of family, close-knit families. So in order for somebody to come onto the ward and the nurse not to care for their family members at the same level as they do the patient is kind of they really have to make sure that everybody's cared for the same patient, family member, or friend. It's really important, because word gets around that such and such a nurse wasn't nice to me or whatever. So they really have to ensure that they're putting everybody on the same level. So ensuring that the patient's family is they know where the fridge is for food or anything like that. Try and give them that at home feeling, because otherwise some of them can really have a bad experience. So I find in talking to the nurses that are here, they really stress the at home feeling as much as possible. I know it's a hospital, but they really try and make them feel comfortable and know that they're only there for a short period of time until they get better, and then they can go home to their families and whatnot. So I find the level of care between an Emerge nurse and an acute care nurse here it's not huge, but there's definitely a difference. As well as the doctors. I've noticed, not having worked in Emerge at home before, I've noticed too that the doctors, some doctors will take the time to explain things and to do, to go through things with the patients, and others just move on from patient to patient to patient, and they're done. Like, they're there for their 12-hour shift, and that's it, that they want to get out of there. So some of them are very thorough with the patients, and they get backlogged, but that's okay, because they're doing their best for the people that they're looking after. Whereas other ones can just go bang, 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 bang from patient to patient, or some of them just kind of saunter along and take their time and don't. They have that caring aspect, but they don't have the aspect of caring for the fact that somebody's been sitting there for 4 hours and still haven't seen the doctor. So it's really, I find there's a big variation in the way doctors care for patients as well on Emerge. I've worked with the doctors in Emerge. I haven't worked with them on acute care, so they may be a little bit different in that situation. But in the Emerge here, sometimes it's a small Emerge, but when it does get hectic, it's tough. it's tough to keep up because there's only one doctor or only one resident to look after everybody. So their level of care is much different than the level of care from that a nurse would give for sure. And the doctors, depending on the situation, if it's a younger child or a younger person, they often are very, very good at including the family and including how they feel and or how they incorporating the way they feel and giving them information about how their loved one's doing and things like that. They're very good in that situation, but sometimes I've noticed again that they can also go the other way. They just don't have that bedside manner, as I would always call it. I mean, I'm speaking from experience. When I was a kid, after I was diagnosed, some doctors had really nice bedside manner and would treat a 10-year-old as a 10-year-old. And other ones would use jargon that I didn't understand or my parents didn't understand, which I don't find very caring to the person. You have to speak on the level they understand. Yeah, I know you're a doctor or whatever, but make sure you have to speak to what people understand, because it just makes them feel stupid otherwise. So they have to. The doctors are. It varies. It's. I mean, and it may vary everywhere too. I'm not sure if it. I mean, I can't say that for sure, but I've really found, and there's a lot of residents up here, a lot of resident doctors, so a lot of younger ones that have that better bedside manner and have more ability to speak at the person's level and tell them kind of what's going on and what the situation is. So yeah, so I'm just going to kind of close in what for me being in the Emerge. I haven't been there very long, but I'm not sure as it's quite my thing, just because I am a very caring person and want to ensure that everybody gets the same level of care and everybody is treated the same, patient, family, friend, whatever it may be. I really want to make sure that they're all treated in the right way. So I think maybe, kind of surgery, acute care, medicine's maybe more my thing, just because I want to ensure that. I mean, not that I can't do that on Emerge, and I'm first couple of days for an Emerge, I was like, this is not my thing. But I've kind of switched my mind a little bit, starting to come around to things. Now that I'm kind of in the groove and I know where things are and kind of what to do, I feel a little bit more comfortable there. So I may be able to portray my caring aspect in emergency just in a different way than other nurses do. But for me, caring for somebody ensures that they know what's going on, their friends and family that are there know what's going on, to the best of their knowledge and my knowledge in wording that they understand. I find that's best to care for people. So, I mean, just treating a person like a person and as you would want to be treated, I think, is the best way to care for somebody in the medical world. So, yeah, there's video number 1. I'll do another one on communication in a couple of weeks. So hopefully this works out. Thanks, Carrie and Jesse. Really enjoyed it up here.